Diabetes is a very, very difficult disease to deal with. It is really sort of easy once you control it, but it's really difficult for patients, a lot of patients, to be able to have that discipline and control their diabetes. It is a multisystemic disease, meaning that it does not affect only your kidneys. A lot of people think that the kidneys is the one thing that they need to be preoccupied about, but it's everything. Every little aspect of your body gets affected by diabetes. So that's why we are very strict when it comes to diabetes management. If we don't treat the diabetes in the earliest stages, or if we don't apply the proper medications to the patients, then everything's just going to crumble and break loose. So we try to sort of be on top of things. How many of you have heard borderline diabetes? Right? Well, that term was dropped about 10 years ago.
How many of you have been a little bit pregnant?
Okay, that doesn't exist anymore. And the main problem that now we are facing in the medical field is the fact that a lot of doctors don't have the knowledge to be able to understand how diabetes works, and then they are still using that term borderline. That doesn't exist anymore. It's either pre-diabetes or diabetes. So we are very, very concerned about the pre-diabetic group, because pre-diabetes is the prelude to the diabetes itself. And we want to treat the people when they are pre-diabetics, because that's when you can change your lifestyle. That's when we can sort of give you all the education about your changing your lifestyle and everything, and then you don't develop the disease. Because once you do, that's it. I mean, it's really hard. A lot of people think that they can do changes like that and then they'll get away from the disease. No, you'll have the disease, okay? If this is something that was started because of your poor lifestyle, perhaps yes, because we've seen it in the studies that were done in patients that had the gastric surgery. They had high blood pressure, they had diabetes, and once they sort of lost all that weight and then they went into doing their changes in terms of the lifestyle, everything went away. Now the risk is there always for the rest of your life, but it's just that. I mean, if you change your lifestyle, then you'll be able to probably put that disease on the side. However, that's not the norm, and when if you have a high load of genetic predisposition, regardless of your lifestyle, sometimes that's going to be there. Okay, I have plenty of patients that are very thin, they exercise, they do everything that they're supposed to do, but they still have the diabetes. Okay, maybe they can control a little bit better, a lot easier than someone who is out of shape but doesn't have a good eating behavior, but it's still the disease is there. Okay, so you as future nurses, you have to understand that you guys have to be careful about your patient. Okay, you have to really understand how diabetes work, because that's how you're going to be able to attend to them. Otherwise, I mean, I know Elena and I know a lot of doctors. An MD after our names doesn't mean anything. If you don't know how to be a clinician, if you don't know how to really do therapeutics with your patients, that doesn't mean anything. Even if you would have gone and graduated from Harvard, that doesn't mean anything. And I know a lot of people that have really the knowledge, they're smart, but they don't know. I guess to be able to treat diabetes, you have to be passionate about it. Diabetes is it's a very tricky disease. You have to spend time with your patients. It's not like a 5-minute consult, that's it. I mean, a lot of you might be working right now in a doctor's office and you see how the flow is. Well, the difference between Elena and I and the rest of the doctors is that we apply our time. Our time is precious for our patients. So if we take half an hour to 45 minutes to even an hour and a half with each diabetic patient, it's because the patient deserves that much of a care. Okay? So if you guys come to our office here in Santa Fe, or if you guys want to come to my office in Las Vegas, you're welcome. Okay, and we'll teach you as much as we can in terms of diabetes. But just pay attention to your patients. If any of you are doing any rotations at the hospital, you know, blood sugar parameters. I don't know if Lane talked about that, but you know, we have set numbers of blood sugars that we need to be paying attention to. And for if any family members, if you guys start seeing numbers more than 100, then just keep in mind that could be pre-diabetes. Okay, diabetes is not it's not occurring just in the Latino population. It's occurring across all ethnic classes. So just be careful, okay? Any questions?
Good. Any questions? You have one, Jackie? Okay, hold on. Let me see. Oh, it's running, right?
How long does it take for the leg to be on stage 3?
Okay, this is 1 to 5 days. This is 2 years later to try to get it back when you have diabetes. And this is poor control. Okay, this is 2 years later. If you're really aggressive like we are, we could probably do it in 6 months. But that's being super aggressive. You know, and that's getting the patient to get off that foot, make sure it's elevated, make sure we've got good circulation. You know, we try to get them into hyperbarics, which is the hyperoxygenation chamber, to bring oxygen to that area because circulation is poor. So we've got to work very hard at increasing the circulation to the area that needs to heal.
That's scary.
So how come you don't use maggots in healing those ulcers?
They do. They still do.
It's just not heard of very often.
Oh, but it happens. I've seen it here at St. Vincent's. I've seen it quite a bit. It's still being used. The problem is that if you have poor circulation, the maggots are being used to eat away at the dead tissue. Mm-hmm. But if your circulation is poor and the maggots have eaten away at the dead, the healthy tissue will die away too if the circulation isn't there. Mm-hmm. But yes, it's still being used quite a bit.
Well, anybody else? I think that might be it. Elaine, thank
Well,
you so much.
thank you all for having me.
Thanks for coming.